Hello, my name is Dr. Ali Haider, and I'm a board-certified cardiologist and interventional cardiologist.
Hello, my name is Dr. Bernard Ashby, and I am a quadruple board-certified vascular cardiologist.
My name is Dr. Marie-J Chukwuemurije, a board-certified cardiologist with an expertise in sports cardiology. Heart health is central to well-being, but did you know that underlying cardiovascular conditions can increase risk of developing herpes zoster, commonly known as shingles?
Today, we want to explore the link between cardiovascular health and shingles. We'll uncover the potential mechanisms behind this connection, how shingles can impact patients with chronic heart disease, and, most importantly, what you can do to reduce your patient's risk. Let's take a closer look at this important topic.
Herpes zoster is caused by a reactivation of latent varicella zoster virus, or VZV. Primary infection with VZV leads to chickenpox. After recovery from chickenpox, VZV remains in the body and establishes latency in the nervous system.
The CDC estimates 99.5% of people born before 1980 are latently infected with VZV.
Here's the thing. Years later, reactivation of varicella zoster virus can occur, causing herpes zoster, which typically presents as painful blistering rash along one or two adjacent dermatomes. Symptoms can be perceived as burning, itching, tingling, and deep aches, which can negatively affect sleep quality, work productivity, social activities, and overall quality of life.
The most common complication of shingles is post-herpetic neuralgia, or PHN, which occurs in 10 to 18% of cases. PHN is nerve pain that can last for months or even years after the rash resolves. Risk factors for herpes zoster include older age, being immunocompromised or immunosuppressed, being assigned female at birth, and having certain medical histories. In fact, herpes zoster can affect any adult who has been exposed to VZV, and the risk of herpes zoster increases with age. It's important to remember that patients with certain cardiovascular conditions are at increased risk as well.
Let's get into specifics. Many cardiovascular conditions have immune system activation contributing, which may increase susceptibility to infections. The basic pathophysiologic mechanisms underlying most cardiovascular conditions are not fully understood.
However, growing evidence suggests that immune system dysregulation and inflammatory pathways may play an important role in cardiovascular conditions, including cardiomyopathies, heart failure, hypertension, myocardial infarction, pericardial diseases, rhythm disorders, and valvular heart disease.
In coronary artery disease, a combination of generalized cell-mediated immunosuppression, monocyte macrophage metabolic dysregulation driven by nutrient excess, and heightened inflammation may contribute to an increased risk of herpes zoster. These factors are further exacerbated by increased expression of the immunoinhibitory protein PD-L1 on immune cell surfaces, which inhibits T cell activation, proliferation, survival, and effector functions. This process is marked by an increased proportion of CD4 positive CD28 null and CD8 positive CD28 null T cells, further compromising adaptive immunity and increasing vulnerability to infections. These T cells are pro-inflammatory and cytotoxic to the endothelial cells.
There is a potential risk of stroke or MI following herpes zoster. There are 3 proposed mechanisms which may lead to an increased risk of cardiovascular events: autonomic dysfunction, inflammation, and VZV-induced vasculitis, which can lead to vasculopathy, which can cause stroke or MI.
The occurrence of herpes zoster-associated myocardial infarction, or ACS, varies according to follow-up.
When it comes to the duration of increased risk of stroke following herpes zoster, most studies indicated that the risk is highest in the weeks just after herpes zoster and decrease with time. Limited evidence suggests increased risk of stroke following herpes zoster may persist beyond 1 year.
When it comes to those with cardiovascular disease, the USA CDC ACIP recommends RZV for herpes zoster prevention in adults aged 50 years and older, including those with chronic medical conditions, and in adults 19 years or older who are immunodeficient or immunosuppressed because of disease or therapy.
Your adult patients 50 and over are encouraged to approach their healthcare professionals for guidance on how to recognize, understand, and reduce their risk of developing this debilitating disease.
While it may not seem like it on the surface, having a discussion with your patients is an important step to actively combat herpes zoster.
A more informed patient, an open and trusting relationship, and a scrutinized, agreed-upon treatment plan will all help produce an atmosphere of prevention.
Herpes zoster impacts more than 1 million people in the U.S. every year. Raising awareness about shingles, its risk, symptoms, and potential complications is key to ensuring individuals with cardiovascular disease have the knowledge they need to take preventative action.